So I was introduced to pharmacy at a very young age. My dad has been a drug rep my entire life. So I grew up around the pharma industry and hearing him talk about pharmaceuticals and having conversations around what drugs can do. When I turned 16, I got my first job at a pharmacy. I worked at my local independent pharmacy in Centralia, Illinois, Bird Watson, and I got introduced to pharmacy in such a wonderful way, having that experience of what a local independently run pharmacy can bring, and the care that they can give to their patients and the intention that they can provide to their patients. So that was a great experience. Fast forward a few years, I started pharmacy school at SIU Edwardsville. And when I started there, I got a job as a pharmacy intern at Walgreens in Edwardsville. Throughout pharmacy school, I wanted to be a community pharmacist. I thought I was going to be a pharmacy manager. So that's really where my focus was. I didn't love pharmacy school, to be honest. I really didn't have a passion or didn't find my niche or my specialty or anything that was really calling at me more than community pharmacy at the time. When I graduated, I took a position with Kroger Pharmacy, and I was actually able to get a unique experience with Kroger. And I did that by going to an underserved area. So I transferred to Southern Illinois, Western Kentucky area, and I acted as the patient care specialist for Kroger pharmacies in that area. Had days where I just walked around and talked to individuals shopping in the grocery store about their health, asked them if they were up to date on their vaccines, took their blood pressure while they were standing there, and I was able to really bring a unique experience to community retail pharmacy. However, I was not done going to school. So while I was working that job, I started my never-ending journey to a PhD in pharmacoeconomics, health economics. So I enrolled in an MBA program, Master's in Business Administration, as well as a program in pharmacy outcomes. And through that program, I really found my passion. That program introduced me first to the balance of providing good clinical outcomes, but doing so while doing it in a cost-efficient way. And that's how I got introduced to managed care. So about 3 years after finishing pharmacy school, I transitioned to a position with Cigna Healthcare, where I worked as a managed care pharmacist, a clinical consultant. I managed benefits for groups of 200,000 individuals or more and tried to provide a pharmaceutical benefit that offered them exceptional care and great outcomes, but at the same time reduced costs, identified egregiously priced drugs, and built policies and procedures, clinical outcomes policies that would really drive utilizers and associates to a low net cost. After that, though, I did transition to the pharmaceutical industry. So I did a small pivot, still staying in the outcomes space, but I now work as a medical outcomes specialist for Pfizer. And the work that a medical outcomes specialist does is works with individual physicians, healthcare practices, health systems to identify gaps in care, identify ways that outcomes could improve, identify ways that spending could be controlled, waste could be eliminated, and then improving patient access to care, improving the patient experience and patient's outcomes. So that's where I am today, and it's very unique work and very challenging work, but very rewarding at the same time. The biggest topic in healthcare right now is how the costs of healthcare are continuing to rise. and how they're just not sustainable. And so I think my work that I'm doing as a medical outcomes specialist and really focusing on clinical outcomes, health economics, is putting the pharmacist in the forefront as not just the drug expert, but the person that has the tools to step in and say, okay, I can tell you all about this drug, but I can bring an economic and an outcome background as well. In the future of medications, the future of pharma is really justifying the spend and how to control these costs and contain costs. So I think I'm really expanding the role of the pharmacist by getting our foot in the door and identifying that pharmacists are the correct people to help make these decisions about outcomes and costs and clinical justification. I think the biggest challenge is perseverance. It's really tough it's a tough pill to swallow when you've gone through 6 years of school, you've earned your doctorate, and you can admit that I'm not done learning. So I think a challenge is continuing my education and continuing to gain skills within this unique niche of pharmacy that I'm in. My former boss, Brian Butler, hopefully he'll watch this video and appreciate this, but he knows that I've said I wouldn't be where I am today if he hadn't have taken some risk on me. So when I first applied to kind of pivot my career into health outcomes and pharmacoeconomics at Cigna, I wasn't fully trained. I didn't have a lot of experience. I was in school and learning about the field, but I didn't have any actual experience. And he saw something in me and saw that I had the transferable skills, saw that I had, those soft skills that would make me successful in this role, and took a chance on hiring someone that he knew he'd have to put a little more training into than someone that was more seasoned, but in the long run had a lot of potential. So he's really been vital in getting me to where I am today, and that really taught me a lesson that the person that's applying for a job is more than what's on their resume. When I was a P1, I knew I wanted to be a community pharmacist, and there was no telling me otherwise. So I think I would just tell that P1 Casey to keep an open mind, that you don't have it all figured out yet. You may think you do, but you don't know where you're going to go, and you need to keep an open mind and probably pay a little more attention in class. I would hope that in 10 years we're recognized healthcare providers by the federal government, and that's worked into Medicare and Medicaid, and that's gives us the ability to really expand our clinical services, the clinical services we can provide and get reimbursed for. I also hope that pharmacists become more involved and active in the profession and advocating for the profession, and that there's an expansion of the role in pharmacists and how to drive down healthcare costs, because we have a lot of value that we could bring.